Good morning. Thank you all for coming. My name is Zoe Barnard, and I'm the administrator of the Addictive and Mental Disorders Division at the Montana Department of Public Health and Human Services. Welcome to today's update on the overall effort in Montana to address opioid abuse and substance use disorder. And when I say overall effort, it is really just that. This has truly been a team approach, and the progress that has been made possible through a combined effort across various key stakeholders. You're going to hear from some of the team members today. Thank you all for attending, and thank you for all the work that all of you are doing on so many levels. Today's event is important because it's vital that we continue to raise awareness about the important issue of opioids and to let the public know about the resources that are available for those who might still be struggling from either opioid abuse or any other substance use disorder. And I'm going to keep it brief and turn things over to our governor.
Thanks, Zoe, and thank all of you for attending. I certainly echo Zoe's comments in that addressing prescription drug, opioid abuse, and substance use disorders in Montana, it's extremely complex. But it's an issue that we know that with teamwork and really a foot-forward approach, we can continue to make progress. There simply is too much at stake not to address the invisible epidemic that Montana and so much of this nation faces. And here in Montana, we refuse to let the complexities or the challenges be used as an excuse for inaction. When I was elected Attorney General in November 2008, and I was just reflecting on this, that this is right when we were starting to see this in Montana. And in some respects, I think we are ahead of the curve in seeing the challenges of it. It was the invisible epidemic that no one was confronting. And the beauty of actually getting to be one of the speakers with Dr. Gallia today is that when I first, as Attorney General, started saying, how do you look at this as a public health issue, as a law enforcement issue, as an education issue? It was about a decade ago that I appointed you and your counterpart, Dr. Kunzweiler, who were the two ER docs, to say, provide us that perspective that you see on the front lines each and every day. And that work that's been going on in the state for a decade now certainly still continues today. We really are ahead of the game in the area of prescription drug abuse compared to other states. And I believe it's because so many folks, and so many of the folks in this room also, recognized the issue early and took action. Starting in 2010, I kicked off Montana's first statewide prescription drug take-back day. Never forget the day that we did this and somebody turned in a glass pill bottle from 1958, recognizing that people continued to hang on to those drugs in their medicine cabinets. We began raising awareness of the impact of this invisible epidemic, particularly on children and on family and friends all across the state. We created the Prescription Drug Registry and secured funding for prescription drug drop boxes, now expanding those locations far beyond law enforcement, which it was a handful of years ago, and into several hundred pharmacies across our state. We passed laws designed to directly help save lives from overdoses. Most recently, we reauthorized Medicaid expansion, which is probably the single most important vehicle to reduce substance use and substance use disorders. Under expansion, states can fund coverage for the prevention and treatment of those at risk of or actively battling substance addictions, the same as they would get treatment for physical health ailments. And it really is this healthcare, both physical and mental, that allows people to get the care that they need. It allows them to work, to receive the opportunity to improve their lives, and to succeed in today's economy, free from opioids or other substances. Today I get to be a part of, collectively we're releasing a new report that illustrates the progress that we've made in our state. The key findings from the report indicate that between 2012 and 2017, we experienced a 4% overall decrease in the opioid prescription drug rates in Montana. But even more significantly, the average daily dose of prescription opiates decreased by nearly 23% during the same time period. Additionally, the proportion of Montana residents prescribed high and very high doses increased by 35 and 40%, respectively. And looking over the greater continuum, the rate of opioid deaths per 100,000 or attributed to opioids is about a quarter of what it was a decade ago in Montana. This new information shows that Montana healthcare providers and Montana healthcare systems are working hard to find that balance between the appropriate prescribing of these medications while simultaneously ensuring their patients are receiving the care that they need. There are many other milestones to share from this report that you'll hear about from our speakers today. As we recognize some of these accomplishments today, I want to make sure that we're also recognizing those areas that we need to keep improving and that we are all certainly committed to continuing this work. I often think about that time a decade ago when opioid abuse was first really emerging. But it was an issue that we wouldn't talk about at the dinner table, or with our friends, or with our kids, or in our workplaces. We've certainly changed that today, but we must keep doing so to ensure that opioid use continues to trend downward. I would certainly, in closing, want to thank all of those who continue to pour their time and energy into the Substance Use Disorder Strategic Task Force. Also want to remind everybody that National Drug Take Back Day is October 26th. Today we have more drop-off locations in Montana than ever before, with over 165 boxes in 55 counties. This increase in the number of locations as of late was a direct result of a grant that we announced in August of 2018. Hope that more Montanans will take that time to look into their medicine cabinets and properly dispose of unused medications. So thanks so much, in all sincerity, for the work that you're doing. It's so easy to get sort of numbed by the statistics and the percentages, but recognize for every one of those numbers, those are also lives changed and indeed at times lives saved. We all share that goal of reaching a time in our future where the opioid epidemic no longer steals away too many lives. And I'm certainly grateful that there are all these partnerships to reach that goal. Thanks so much.
Thank you, Governor Bullock, and thank you for all of your leadership and support in prevention and treatment of substance use disorder and opioids, certainly during my time at the department and before. Our next speaker is Greg Holzman, and I'm honored that my friend Greg is going to talk about our report, and he is the State Medical Officer for DPHHS.
Thank you, Zoe. And I'd like to reiterate what Governor Bullock stated and noted. Today, while we're talking about the opioid epidemic or the opioid crisis, it's also really important for us to spend a few moments to realize that we are working to address all substance misuse and abuse within our state, whether that be tobacco or alcohol or methamphetamines or whatever else is out there. We are also, I want to say, very concerned about suicide in the state. And I bring these forward because when we move upstream and look at what are some of the commonalities, what are some of the things that we can do in prevention, we find that there's a lot that crosses over in these areas. In fact, in many public health forums, these diseases are called diseases of despair. Regarding substance misuse and abuse within the state of Montana, I do want to emphasize that alcohol is still a major problem, with about averaging 475 deaths a year occurring due to excess alcohol use. Methamphetamines has been going in the wrong direction nationally. And while opioids, we have not seen the devastation that has happened in so many other states, and part of that, I believe, is because we responded so early. Something that Governor Bullock did not say was our highest peak of opioid overdose were in 2009. So that quick response, and we've seen continued decreases of overdose deaths since that time, which is very unusual compared to most other states. But even though the numbers are lower in the state of Montana, they are still preventable deaths, and each preventable death is one death too many. So from DPHHS, I would really like to say a moment to say thank you to the governor's office, to the legislators, to public and private entities, to universities, and everybody else who has been working so hard through different coalitions and their communities to the state level to address all these issues. As a public health professional and a physician, I think I look at this epidemic with slightly askewed vision and through different lenses. As a public health professional, we look at the health of the community. We use epidemiology and data to decide how healthy is that community doing. But as a physician, we work with individual patients, working with them one-on-one with shared decision-making to help them live their best and most healthy lives. For healthcare professionals, it is very important for them to understand the population data of the communities that their patients live in, work in, and play. It is not easy for us in the healthcare field to navigate that fine line between figuring out the risk and benefit, what medications or treatments are available, what are covered by insurance, and make sure that we are always doing the best for that person in front of us. As a caring physician, public health professional, we look at this opioid epidemic and think of two strong goals that we want to do. It's fairly simple. We want to minimize, prevent unnecessary opioid prescribing. And two, we want to make sure that prescribed opioids are not used by individuals in whom they were not intended. This is done by weighing the risk and benefits with each patient and deciding what is the best plan forward. And that if you are going to use opioids, that you have a clear understanding of how you will take those patients off opioid medications once the risk outweighs the benefit. Sometimes we often say, if you don't know how to land the plane, don't start flying. When we talk about the prescriptions, we want to make sure that only what is prescribed is needed. Prescribe at the lowest possible dose for the shortest possible time to prevent ill consequences. We want to encourage, as the governor talks so much about also highly, is that if you have leftover medications, please dispose of them properly and environmentally safe. And there are a lot more drop boxes around this state. And lastly, for those individuals that do need to be on a higher dose opioid medications because the benefits do outweigh the risks, we want to make sure that they're also prescribed Naloxone and that the people around them know how to use this life-saving medication in case an accidental overdose ever occurs. This report is encouraging because we're seeing the overall number of opioid prescriptions going down. Not rapidly, and that's probably a good thing because we don't want any unintended consequences, but it's moving in the right direction. When I look at this data, I feel very encouraged to see that young people are less likely to get opioids, that the overall morphine milliequivalents, or the strength of the opioids, are coming down, and that the length of time people are on the opioid medications, or the written for the prescriptions, is decreasing. These are all very positive. And I'll just end it with saying something that I've said often. I think there's very clear. We need to make sure that anybody who has a substance use disorder has access to evidence-based treatment. We need to make sure that if a person is on higher dose opioids and the risk does outweigh the benefits, that they are weaned slowly, carefully, and with compassion. And lastly, for those that do need to be on higher dose opioids because the benefit does outweigh the risk, that they are taking that medication in the safest possible way for them and for their community. Thank you.
Thank you, Greg. Next, we'll have Dr. Bill Galley. Dr. Galley has been a champion in Montana for many years in the importance of increasing naloxone access in our state. Please welcome Dr. Galley.
Thank you, Zoe. As an emergency physician on the front lines of Montana's response to the opioid crisis, I can say I'm extremely excited by the data presented in this report. While we still have work to do, we clearly have made great progress. My remarks today will highlight, as you were told, the critical role of naloxone in saving lives due to opioid overdose. But first, I also need to say some thanks. I thank Governor Bullock for making this issue such a priority during his tenure in statewide leadership. Way back as Attorney General, when he formed the Prescription Drug Abuse Advisory Council, we then proceeded to enact in 2011 the Prescription Drug Registry on our third try. That registry is what gives us some of the data that we're highlighting today. And then in 2017, we were able to get our naloxone legislation passed. So I want to thank also Representatives Frank Garner from Kalispell and Gordon Pearson from Deer Lodge, who respectively sponsored House Bill 333 and 323. Together, these bills are what enabled essentially everyone in Montana who should have access to naloxone the ability to have and use naloxone to save lives. And lastly, I want to thank the entire Montana legislature in 2017 because House Bill 333 was passed unanimously. House Bill 323 had only 3 nay votes out of 150 legislators. So clearly we can in Montana overcome divisive politics. So, why is naloxone so important? To understand that, we have to understand a little bit about opioids themselves. When taken in the right dose, they can do a tremendous amount to alleviate pain and suffering. When taken a bit too much, or when combined with other medicines that might depress your brain function, what happens is that you will slow your breathing and lower your oxygen level. And you will also get so sleepy that you won't wake up to catch your breath. So in effect, with too much opioid in your system, you will die from lack of oxygen. Naloxone is a medicine that quickly and completely reverses all these effects of opioids. And it can be given intravenously, or it can be injected in a muscle. And it even works when it's squirted in your nose. And so it's easy for people to give, even who aren't comfortable giving shots. In our battle to prevent death from opioid overdose, our goal is to have naloxone in every fire truck, every squad car, every clinic and school, and to be carried by everyone who is prescribed a high dose of opioids, or perhaps is addicted to them, and carried by anyone who might encounter a friend or family member who is at risk for opioid overdose. That's our goal. How are we doing? With the standing order signed by Montana's medical officer, Dr. Holzman, thank you, Greg, any individual or agency who should have naloxone can now go to a pharmacy and get it. Through DPHHS, over 2,000 units of the drug have been distributed to fire departments, law enforcement agencies, the Fish and Wildlife Service, the Boy Scouts, local health departments, as well as mental health and substance use disorder treatment programs. Over 400 individuals have been trained as master trainers to teach the proper administration of this life-saving drug. In 2019, so far, just 9 months, naloxone has been administered over 500 times by first responders in the community. That's almost 2 times each day. We've not yet achieved our goal of universal distribution of naloxone to all the appropriate individuals, but we are making progress. I will close by sharing 2 stories from my own practice. The first happened last winter. A Fergus County deputy responded to a call that there was a man down, not responding, and he found him barely breathing with a weak pulse. It looked like a situation that might be naloxone overdose. When naloxone is given in an overdose situation, it works quickly. If it's not an overdose situation, it does no harm. So the deputy had been trained in the proper use of naloxone. He administered it. The person woke up. It was definitely way improved before even the local first responders had responded to the call, gone to the ambulance barn, and was able to get to the scene. And it was still 45 minutes before the advanced life support rig from Lewistown would arrive on scene. My most poignant personal story happened last year. I was on duty in the emergency department in Lewistown when the call came out, paging Lewistown Fire and the CMMC ambulance to respond to a local residence. And the call was, a 6-year-old is not breathing. For any of you in emergency medicine, you know that is probably the most frightening thing that you can hear. So we immediately got into action. We were assembling our team. We were being prepared to initiate life support as needed. The possibilities here are numerous. It includes, this might be the result of a bad asthma attack. It might be the result of a severe infection, such as meningitis or pneumonia. It could even be related to trauma. All we knew was that there was a 6-year-old not breathing. Before the boy arrived, we actually learned a bit more information. We were told that when first responders arrived, they did not feel a pulse, so they actually started chest compressions. We heard that he had been watching movies with friends, had eaten some candy, had appeared to fall asleep as if taking a nap, and that then couldn't be awakened from his nap. Hearing about the candy, I thought, well, that means maybe we should be considering, could he have a foreign body in his throat? So he arrives, and indeed, he's not responding. He's not breathing on his own. He's being breathed by the paramedics with the bag and mask. I was preparing then to give powerful muscle-relaxing drugs so that I could look in his throat and I could remove a foreign body if one was present, and I could also pass the breathing tube so that we could protect his airway, we could properly ventilate his lungs. It was at that point that our very astute paramedic noted for me that his pupils were really tiny. They were actually the size of pinpoints. And that actually is one of the classic signs on the physical examination of a possible opioid overdose. So with that, the first drug we administered was naloxone, not the powerful muscle relaxers. And within a minute, the boy woke up. So I'm happy to tell you that he's now survived this and is well, but it took 3 days in the hospital on an intravenous infusion of naloxone to get him over this. It turns out that the candy was oxycodone that had been left unattended in the home by the adults there. Clearly he had eaten a lot of candy. So this story highlights a couple of things in addition to the life-saving role of naloxone. As has been mentioned, we clearly need to store our medicines safely and properly so the kids don't have access to them, or so that they can't be stolen or taken by people who shouldn't have them. The other thing is we also clearly need to dispose of our medicines properly. Thank goodness for not only the drug take-back days, but especially for the opportunity to go to pharmacies and law enforcement agencies and dispose of our drugs properly. So with that, let's all go out and spread the word about naloxone. Thank you.
Thank you. Next, we're going to have Dr. Mark Mantell speak. Dr. Mark is someone whose name I hear a lot. He's involved in a number of our efforts, including he's the chair of the Substance Use Disorder Task Force. And he's going to talk about the Know Your Dose website. Dr. Mantell is the president of the Montana Medical Association.
First, I'd like to recognize and acknowledge what everyone else has already stated. Where we're at today in the state of Montana could not have been accomplished without a team effort between the physicians of Montana, the Department of Public Health and Human Services, the governor's office, and the governor when he was the AG as well. None of these things could have been made possible without the teamwork that's taken place in the state. I'm going to start out with taking a historical perspective, though, to kind of give us a frame of where we're at and where we're going and where we've been. Currently, approximately 50 million U.S. adults suffer from chronic daily pain. 20 million adults suffer from what we call high-impact chronic pain. This is pain which is severe enough to limit an individual's ability to engage in meaningful work or other life activities such as sleeping, eating, dressing, bathing, walking, and even having simple conversations. The condition of chronic pain costs the U.S. industry approximately $560 billion annually on direct medical cost, loss of productivity, and disability programs. In the 1990s, it was this condition that prompted the medical community on a well-intended and bold journey. The journey was to start treating chronic pain as any other medical condition and bring this condition out of the shadows. The goal was to restore hope and give back life to those who were suffering. As is true with many good intentions, unintended consequences can occur. This was the case when we started treating pain as a fifth vital sign. Opioid prescriptions started to see a rise. This was further fueled by pharmaceutical companies creating higher and more potent and longer-acting opioids. These same companies used aggressive marketing techniques to distribute these opioids based on questionable science, while at the same time physicians were being pressured and graded in how well they were treating pain by national organizations. These two things in combination created what we have today, the opioid epidemic. The Montana Medical Association was attentive to the situation and took a proactive approach. In 2013, we formed a task force on prescription drugs, and in 2014, 2 years prior to the CDC recommendations on prescribing opioids, we launched the knowyourdosement.org website. The website was free online education for all prescribers on best practices for prescribing opioids, monitoring opioid prescriptions, and how to manage chronic pain without opioid escalation. Also included was an online toolkit with patient documentation forms, treatment protocols, and pain policies for all prescribers in Montana. It even provided information for patients on how to store medications, dispose of medications properly, and how to utilize techniques other than medications for management of their pain. So how did we do? And how are we doing? Currently, Montana is in pretty good shape. Prescription opioid overdose deaths are some of the lowest in the country compared to other states. Our current rate of prescription opioid deaths is just about where it was at prior to the opioid epidemic starting. It doesn't mean that we can stop being vigilant, however. We're not out of the woods yet. Heroin and illicit fentanyl are on the rise, and these drugs still remain a significant threat to Montanans' health and well-being. In order to combat this threat, the Montana Medical Association Substance Use Disorder Task Force, in conjunction with and support from the Department of Public Health and Human Services here in Montana, are creating a second Know Your Dose website. The new website is dedicated to the treatment of opioid use disorders, as well as to new and better ways to manage patients who suffer from chronic pain. The online learning site consists of 18 15 to 20 minute modules dedicated to such topics as the evolution of opioids in Montana, how to treat chronic pain with patients on buprenorphine, ethical opioid prescribing using the CDC guidelines, how to appropriately care for and monitor patients with chronic pain on high-dose opioids, how to safely taper patients to lower opioid dosages with chronic pain, how to identify an opioid use disorder, how to use the prescription drug registry, the basics on treating a patient with an opioid use disorder, understanding medication-assisted treatment, how to counsel and talk to your patients who have a substance use disorder, plus several other modules such as special populations, law enforcement, and talking with patients who are in the prison system. It is our hope that the next version of the KnowYourDoseMontana.org website will address the next anticipated phase of Montana's opiate epidemic, while simultaneously not forgetting about our family and friends who suffer from chronic pain. We hope we can find, and this education will help find a balance between those people who can be helped from opioids and those who might be harmed. Thank you.
Thanks very much. Our last speaker will be Cindy Sturgar of the Montana Primary Care Association. Cindy's going to talk about the evidence-based treatment that's available for opioid-related disorders. And I am pleased to report that our partnership with the Montana Primary Care Association, whereas when we first received a grant from the federal government to implement opioid-related treatment, we had about a dozen providers who prescribed across the state. The latest I heard is that through the work of DPHHS and the Montana Primary Care Association, we have over 130 prescribers. So thanks, Cindy.
Thanks, everyone. I'm not going to say much new except thank you for the coordination and the partnerships, because Montana can't do it alone. So the leadership from our governor when he was Attorney General through today and on to tomorrow, and Zoe, has really been the ticket here in our state. The Primary Care Association is composed of primary care centers, mostly community health centers and urban Indian centers. But the training that we're doing is for all providers across the state. So what we believe is, just like diabetes, substance use disorder is a chronic disease. Just like with diabetes, we provide opportunities for our clinicians and our teams, our clinical teams, to learn about new ways and evidence-based ways to treat a chronic disease. And medication-assisted treatment is one of those ways of treating substance use disorder, specifically opioid use disorder. So what happened in our state is, of course this has been around, but various folks, less than 24 in our state, had the waiver or the ability to legally prescribe medication for medication-assisted treatment. Some of that has to do with stigma. Many of you in this room and many of you in our own families know the stigma that exists around this chronic disease. So when we decided to work with DPHHS and the governor's office to do medication-assisted therapy or treatment training, it's called a waiver, we also include a whole session about stigma. Because if we don't understand how we see someone living with that disease, it's hard for us to help them get treatment. So what we've done in our state, it's a very set, specific type of treatment that has to happen. We brought that training to our state to make it easy for providers, all levels of providers, MDs, DOs, nurse practitioners, PAs, and the team that they work with to attend that treatment, to attend that training to get that waiver. So over the last 2 years, we've trained over, just 10 days ago, we trained another 40, so we're up about 150. So that's a big number for our little state, right? Going from 24 to over 150 people being able to provide this kind of treatment within their clinics, right? So we believe in primary care that we treat chronic disease, and this is a chronic disease. So we know today there's over 600 people being treated just within our small system, and it's double that number across the state. So of course, it's to provide the opportunity to get clinicians the training here on our own soil in Montana so that we can serve our people in Montana. So I just want to thank the governor again and Zoe and the leadership from the medical director of the state and all the work from MMA and all the work that happened in the emergency rooms, the front line, that they, for all the work they're doing right now that they'll continue to do. I just want to say thank you very much.
And And so to wrap things up, we're going to show you some of our recently produced public service announcements. At this time, I'm going to go ahead and invite our speakers to move back so that they can see them too. We will for sure have opportunity for questions and answers after the PSAs. Thank you very much.
Many of the people that I see asking for help, their lives have basically been totally destroyed by their addiction.
This is not just an individual problem, it's a huge public health problem.
As pharmacists, we're on the front lines of the opioid crisis.
So we're trying to be prepared and in front of the situation so we don't have some of the same issues that they're seeing on the East Coast.
And all the preconceptions I've ever had about working with people with a substance use disorder have been, I think, disbanded just with a simple smile and a welcome.
I think the most important thing that I learned is that basically we're all on the same page. We really want to help the citizens of Montana.
You start to get back that person that you're always looking for. Stop hating the person, hate the disease.
Trying to ensure we have the best patient care for those individuals is the most important thing for me.
The aspect of opioid use disorder treatment that I'm most excited about is that people do get better, and they can get better. I've seen it, I see it, and I know it's possible.
One more time, I'd like to thank the governor for his leadership and help in this effort to reduce stigma and provide treatment across Montana. And with that, thank you all for coming.